So when I'm on call in the emergency room, I tend to talk to a lot of teenagers, and I was talking to one girl who had come in to the emergency room because she was having a lot of mood difficulties, and I remember asking her when her difficulties started, and she really talked about how problems had really started a lot earlier, many years before, and her family was saying that in fact they were having a really hard time since she was quite little. The study is called Making the Race Fair, and this is the first study in Canada to look at the effectiveness of the family checkup. So the idea is that when kids are having a really hard time during their early preschool years with behavior problems, or if the family's also struggling with other issues like parental mental health problems or family stress, these things can hold back kids in their development, and we feel that it's important to make the race fair for all kids at the start of their lives.
So it's actually the parents, the caregivers that are part of the intervention. They participate in questionnaires and a videotape interaction task that's standardized, and the children also participate in the videotaped interaction. And then the feedback is given to parents, helping them to understand how things are going on in the family in terms of their parenting and in terms of their child well-being, and then collaborating with parents on what the action plan is.
We know that very early on, parenting practice, so how much parents support their child's learning, how much they're able to set limits in a really warm and effective way, that really helps kids learn to manage their big emotions. And if kids can learn really good emotional self-regulation skills, by the time they're hitting kindergarten, that has spillover effects into the school-age years and possibly into the teenage years as well.
Typical action plan might be that a parent may choose to seek services for themselves because of their own well-being. It could be that they choose to target certain aspects of parenting that they know they could benefit from further skill development on. It could be that they choose to access kind of other community resources in consultation with the clinician they're currently connected to in order to support their family or the child in some way. The long-term plan is to be able then to follow families in the future and see, how are they doing now that they've had the family checkup? How are they doing a year later? Have they maintained some of the skills that they've learned? Have they changed their practice? How's the child doing in terms of their well-being, parent well-being, family well-being? So there is follow-up that is very much part of the family checkup model.
The idea of making the race fair really comes from that idea of, can we as healthcare professionals work harder to set kids up for success and to get them on a more positive path in their development as early as we can?